Welcome to Angel Health Academy. Subject Community Health Nursing, Mnemonic. Topic for the day is Functions and Services of Subcenters. Functions and Services of Subcenters. The primary healthcare infrastructure or institution in rural areas has been developed as three-tier system. That is primary tier system with subcenters, primary health center and community health center. So the primary healthcare infrastructure or institutions, that means institution which are under the primary healthcare, especially in the rural areas, has been developed as a three-tier system, that is starting with the subcenter, primary health center and community health center. This is known as the three pillars of primary healthcare system in India. So the three pillars of primary healthcare system in India are subcenters, primary health centers and community health centers. A subcenter, also known as sub-health center, is the most peripheral and first point of contact people and to the primary healthcare system. That is the community and primary healthcare system. So it is the first point of contact to avail the primary healthcare services, to avail the primary healthcare between the primary healthcare system of the country and to that particular community people. So a subcenter or sub-health center is the most peripheral and first point of contact between the primary healthcare system and the community. Thus, subcenter is considered as the peripheral outpost. It is the most peripheral outpost means institution, health center. So peripheral outpost of the existing healthcare delivery system in the rural area of the country or rural area of India. So in rural area, Government of India rendering healthcare delivery services through the peripheral outpost. That outpost or institution is called as subcenter. Then 6 subcenters are connected to one PHC, or one primary health center cover 6 subcenters. In this video, I am not going to talk in detail or in depth of subcenter. I will make separate video for subcenter. Today I am discussing a brief about the subcenter. The population coverage of the subcenter is in general, that is 5,000 population. So a subcenter cover a population of 5,000 in general and plain areas. Then in hilly, tribal or other backward areas, a subcenter cover only 3,000 population. So in general or in plain area, subcenter cover 5,000 population, and hilly, tribal and backward area or backward area, a subcenter covers 3,000 population. Then types of subcenter. According to Indian Public Health Standards 2012 revised, classified subcenter into two, that is type A and type B subcenter. Type A subcenter, there is no facility to conducting the deliveries. In type B, there are facilities for conducting deliveries like labor room, and it is expected 20 institutional delivery per month from the subcenter, that is type B subcenter. Then staffs of subcenter. There are mainly 2 staff health personnel in the subcenter, that is male health worker 1 and female multipurpose health worker or auxiliary nurse midwife ANM 1. Then according to IPHS 2012 revised, one more person as a part-time worker, that is one Safai Karmachari or one sweeper as part-time as per the IPHS 2012 revised. Usually the staff or JPHN of the subcenter supported by a village health post, which includes a village health guide, DAIs and Anganwadi workers of that particular community or the subcenter belongs. Then the first part of the topic for the discussion is functions of a subcenter. Functions of subcenter. I have made a small mnemonic to understand about the functions of subcenter, that is first aim is health and family welfare program. So you can understand the most and the first important aim of subcenter is health and family welfare program, that is health promotion and family welfare program. So first aim, that is capital letter, so we have to expand. So let us expand the mnemonic. First aim is health and family welfare program. So F stands for first aid, I stands for immunization, R stands for referral services, S stands for simple laboratory services, T stands for treatment for minor ailments, A stands for awareness program, that includes health education and IEC activities, that is information education and communication activities, that is A stands for awareness, I stands for IUD insertion, intrauterine contraceptive devices, that is copper T insertion, M stands for MCH services. Now it is expanded as RCH, reproductive child health services. Then E stands for Implementation of selected national health programs. Implementation of selected national health programs. Health stands for health promotion of the people. Family welfare stands for family planning services. Family planning. Program stands for prevention of diseases, especially locally endemic diseases, LEDs. So let us see what are the functions of the subcenter, that is general functions of the subcenter. So the general functions of the subcenter include 12 different functions. First is rendering first aid services to the public and universal immunization, that is immunization. Then making referral services whenever necessary, either to the primary health center or to the community health center. Then providing or conducting simple laboratory services like urine sugar test, blood sugar monitoring, etc. So simple laboratory services. Then treatment for minor ailments, that comes under curative services of the subcenter. Treatment for minor ailments such as fever, diarrhea, cough, etc. Then various awareness programs, that includes health education or information education communication. Then intrauterine contraceptive device insertion as part of the temporary method of family planning program. Then MCH services, maternal and child health services, that is now extended as reproductive child health program or services. Then implementation of selected national health programs. Implementation of selected national health programs. Health promotion. So the basic services to promote the health of the or basic care to the public, to promote the health of the people or health of the family. Then family planning services, especially for the eligible couples, that includes permanent method and temporary methods of family planning measures or services. The last one is prevention of diseases, especially prevention of locally endemic diseases. Prevention of diseases, which includes prevention of locally endemic diseases and other epidemic outbreaks. So these are the important 12 different functions of the subcenter, general functions of the subcenter. Then second part of the session is services of subcenters. Services which is rendered through subcenters. So services of subcenter as per the IPHS, that is Indian Public Health Standards revised 2012, that is classified as essential services and desirable services, and it includes only desirable services. So as per IPHS revised 2012, the services of subcenter classified into essential and desirable and desirable. I have been made a mnemonic with these two parts. The first part of the mnemonic is up to here. It includes both essential and desirable services. And the second part of the mnemonic, that includes only desirable services. So the mnemonic is major curative services of subcenters really includes OPD and community ward services. So the mnemonic is major curative services of subcenters really includes OPD and that is outpatient services and community ward or field services. Here subcenter is a capital letter. In that CE I have made together. So I will be expand only one word for CE. So please note that or remember that. So the mnemonic is major curative services of subcenters really includes OPD and community ward services. So OPD and community ward services will be based on only desirable services as per IPHS revised 2012. Then major curative services of subcenters really includes that provide both essential and desirable services from the subcenter. So let us expand the mnemonic. So the first part of the mnemonic, that is related to or in relation with both essential and desirable services, that is major stands for maternal and child health services, curative stands for coordination and monitoring, services stands for safe abortion services, that is MTP services, medical termination of pregnancy services, OFF stands for outreach or field services, outreach services or field services, S stands for simple laboratory services, U stands for universal immunization, B stands for basic healthcare services, CE stands for control of endemic diseases. So C stands for control and E stands for endemic diseases. So control of endemic diseases, that is local endemic diseases, LEDs. Then N stands for National Health Program Implementation. T stands for treatment for minor ailments and first aid, that comes under curative services. Treatment for minor ailments and rendering first aid. R stands for referral services. E stands for eligible couple services, that is comes under family planning and contraception. So provision of contraception and family planning services, that is eligible couple services. S stands for school health services. Really stands for record of vital events. So recording the vital events in that area which belongs to the subcenter. Then includes stands for Integrated Disease Surveillance Project, that is IDSP, Integrated Disease Surveillance Project, conducting survey to detect the outbreak. Then the second part of the mnemonic is that is related to only desirable services, that is OPD and community ward services. O stands for oral health. P stands for promotion of medicinal herbs. So planting or growing various medicinal herbs in the subcenters, that is promotion of medicinal herbs. Then D stands for disability prevention. And stands for adolescent health care. Then community stands for care of elderly, that is National Program for Health Care of Elderly, National Program for Health Care of Elderly. And ward services stands for water and sanitation. Ward services stands for water and sanitation. So these are the desirable services of the subcenter. So let us explain briefly about the services of subcenter. That is first part, that is the both essential and desirable services. I'll be explaining in detail when I upload a video about the subcenter with the Indian Public Health Standards 2012 revised version. Okay, I will explain this in detail. Today I am just discussing about the services in relation to the mnemonic. First is maternal and child health. Maternal health includes antenatal care, intranatal care and postnatal care. Antenatal care includes early registration of the pregnant women, antenatal visits. There are nearly 4 visits. Then associated antenatal services which include antenatal examinations, antenatal supplementations and tablets, folic acid, etc. Then TT, that is tetanus toxoid injection. Then antenatal advice, high risk detection, treatment for the anemia and etc. Then making referral if it is needed. So these are the associated services. So these are the services in relation to antenatal care. Then second is intranatal care. That is type B subcenter provide intranatal services or conduct the delivery. So promotion of institutional deliveries. That is delivery conducted to subcenters. Then next is if it is home delivery, provide skilled attendance at home deliveries when it is called for. So if the delivery is conducted at home, that is domiciliary midwifery, then provide skilled attendance. Then appropriate and timely referral for any high risk cases. Appropriate and timely referral for high risk cases during intranatal or intrapartum period. Then postnatal care includes hygiene, postnatal diet, postnatal infection control and postnatal advice. Then registration of the birth, then newborn care, essential newborn care, initiation of early breastfeeding, which includes exclusive breastfeeding, that is up to 6 months only breastfeeding, that is exclusive breastfeeding. Then demand feeding, depends upon the need of the child, depends upon the need of the baby. Then supplementary feeding, after 6 months introduction of weaning, that is supplementary feeding. Then postnatal visit, that is start from the first day, then 3rd day, 7th day and 42nd postnatal day. Then regarding child health, that is set up a newborn care corner at the labor room of the subcenter B, type B. So in subcenter type B, there should be labor room to conduct the delivery and there would be a newborn care corner to render essential newborn care. So that is essential newborn care. Then postnatal visit. So additional postnatal visit has to be done if the baby belongs to low birth weight. That is on 14th day, 21st day and 28th day of postnatal. That is if the baby was low birth weight, additional visit has to be done on 14th day, 21st day and 28th day. Then counseling services, assessment of growth and development of the child and timely referral, making referral if necessary. Then immunization services, that is full immunization, universal immunization for the under 5 child. Then vitamin A supplementation or prophylaxis. This all comes under child health services. The second services is coordination and monitoring services. So services of subcenters are coordinated. Subcenter should coordinate with the other people to render the services such as Anganwadi workers, Asha workers, Village Health Sanitation Committee, Nutrition Committee, then PRI, that is nothing but Panchayati Raj institution like Gram Sabha, Gram Panchayat, Jilla Panchayat, etc. So the second one is coordination and monitoring services of the subcenter. So services of the subcenter to be coordinated with the Anganwadi workers, Asha workers, Village Health Sanitation Committee, Nutrition Committee and Panchayati Raj institutions, etc. The third service is safe abortion services, that is MTP services. So counseling for safe abortion services or MTP services to the couples. Then follow up for any complication after abortion or MTP. So follow up for any complication, then appropriate referral if needed during follow up period. So this is about the services in relation to safe abortion services. Then outreach or field services. Outreach or field services includes Village Health and Nutrition Day, that is VHND, home visit, conducting of home visit, house to house survey, conducting of home survey, then community level interactions or communication with the people. So let us discuss in short about the outreach or field services. So outreach or field services includes the first one is Village Health and Nutrition Day. So organize and conduct Village Health and Nutrition Day at least once in a month in each village. So organize or conduct a Village Health Nutrition Day at least once in a month in each village or each ward. Then home visit. Home visit is done with different purposes. One is for skilled attendance at birth, that is for home delivery, and postnatal visit, then antenatal visit, newborn visit, etc. Then visit has been done to the eligible couples, follow-up cases of family planning services adopters, then visit to the community-based dot providers and visit to the leprosy depot holders. So the home visit may include with the different purposes. One is for skilled attendance at birth for the home delivery, then postnatal and antenatal visit, newborn visit. Other visits includes a visit to eligible couples, visit to follow-up cases of family planning, then visit to community-based dot providers, then visit to leprosy depot holders. They provide the drugs to the community people. Then house to house survey. So conduct a survey once at least annually. So one survey in a year, preferably in the month of April. Then special survey is required. That survey is called epidemiological survey. At least one survey per month to early detection of the local endemic diseases and other epidemics. Then community level interactions. That includes a group discussion with the family members. So focus group discussions and health communications, health awareness program, and conducting IEC, information education communication programs. That is about the outreach or field services, which includes a Village Health and Nutrition Day, home visit, house to house survey, and community level interaction with the community people. Then fifth services is rendering simple laboratory services such as urine test for pregnancy confirmation. Test can be linked to the P.H.C for further required tests. Then other tests like urine sugar test, urine albumin test, and even blood glucose monitoring, etc. These are the simple laboratory services has to be rendered through sub-centers. Then regarding universal immunization. So full immunization to all the infants and children who belongs to the sub-center area. So the full immunization of all infants and children against vaccine preventable diseases as per the guidelines of the Government of India. Then referral and reporting of the cases when there is a adverse events following immunization, that is AEFI. If there is any adverse reaction or events following immunization, that infant or child has to be referred and it has to be immediately reported to the primary health center. That is about universal immunization. Then rendering basic health care services to the community people. So rendering basic health care services to the community people, including curative services, first aid services, etc. Then eighth services is control of locally endemic diseases. So assist in detection, control and reporting of any locally endemic diseases such as malaria, Kala Azar, Japanese encephalitis, filariasis, dengue, etc. So assist in detection, control and reporting of the locally endemic diseases. Then assistance in control, assisting in control any other epidemic outbreaks in the sub-center area. That is assistance in control of epidemic outbreaks. The ninth services is National Health Program. So implementation of selected National Health Programs through sub-centers. That is divided into communicable disease programs and non-communicable disease programs. First is communicable disease National Health Programs include National AIDS Control Program, that is NACP, National Vector-Borne Disease Control Program, that is NVBDCP, National Leprosy Eradication Program, that is NLEP, then revised National Tuberculosis Control Program, that is RNTCP. So these are the some of the communicable disease national health programs which are implemented through the sub-centers. Then National Health Program of non-communicable disease programs, which includes the National Program for Control of Blindness, that is NPCB, that is National Program for Control of Blindness, National Program for Prevention and Control of Deafness, that is NPPCD, National Mental Health Program, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, that is National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, then National Iodine Deficiency Disorders Control Program, then in fluorosis affected areas, fluorosis control programs, that is early detection of the cases of fluorosis, then identification of any deformity due to fluorosis, etc. in the fluorosis affected areas, that is in fluorosis affected areas, that is conducted only in the endemic area of fluorosis. Then National Tobacco Control Program. So these are some of the non-communicable disease national programs which is implemented through the sub-center. The 10th service is treatment for minor ailments and rendering first aid. Treatment for minor ailments and rendering first aid, which includes under curative services. So providing treatment for minor ailments such as fever, diarrhea, ARI, acute respiratory infection, worm infestation, and rendering other first aid services for different measures like snake bites, etc. Then second one is provide treatment as per the choice of the public regarding Ayush, that is indigenous system of medicines, that is Ayurveda, Unani, Siddha, Homeopathy, etc. Then third service is conduct a clinic, that is once a month clinic at sub-center by primary health center medical officer who is belongs to or the respected primary health center medical officer. So these are the services comes under curative services, that is treatment for minor ailments and rendering first aid services to the public. Then 11th services is referral services, making referral, that is appropriate and timely referral services for antenatal mothers, high risk antenatal mothers, postnatal mothers, school children, high risk school children, adolescent with high risk. Then referral for any sick old persons, sick old people if needed, if it is required. And for cases for oral health problems, person at risk for any locally endemic diseases, such as all the people who are risk for or who need further treatment appropriately and timely has to be given referral services from the sub-center. That is about the referral services. Then 12th services is eligible couple services. That is comes under family planning and provision of contraceptions. So education, motivation and counseling for all the eligible couples who belongs under that particular sub-center. That is education, motivation and counseling of all the eligible couples who belongs to that particular sub-center. Then provision of contraceptives. So supply of contraceptives and emergency contraceptives to the people. Then IUD insertion, that is intrauterine contraceptive devices, that is copper T insertions. So that is done wherever ANM is trained in IUCD insertions. So if the sub-center is consisted with an ANM who is already trained with the IUD insertion, she can conduct the intrauterine contraceptive device insertion. Then follow-up services for all the family planning adopted eligible couples, that is permanent method adopted eligible couples, follow-up services. These all the services comes under family planning and contraception for the, especially for the eligible couples. Then 13th service is school health services. So the school which comes under the jurisdiction of the particular sub-center, screening of the school children, that is for early detection. Then treatment of minor ailments or any minor diseases to the school children. Then immunization to the school children, immunization. Then deworming with the albendazole to the school children. Then prevention and management of vitamin A, that is vitamin A prophylaxis to the school children. Then prevention and management of nutritional deficiency anemia, that is iron deficiency anemia among the school children. Then making referral services when it is necessary for the school child. So these are the services which comes under school health services through sub-center. Then 14th services is record of vital events that happens here to the in the area of the sub-center. So recording and reporting of vital events which includes birth, death, maternal death, then infant mortality, etc. So this has to be recorded and reported immediately. That is called vital events. So maintaining the record of the vital events is another services through the sub-center. Then 15th one is disease surveillance, that is integrated disease surveillance project IDSP, integrated disease surveillance project IDSP. It includes conducting a survey, that is surveillance and early reporting of any abnormal increase in any disease cases such as diarrhea, dysentery, fever cases, fever with rigor, fever with any rashes, etc. Then immediate reporting of any cluster or any outbreak in the sub-center area, the area which belongs to that particular sub-center. So any outbreak which occur in the community, notified or early reported. Then high level of alertness, vigilance for any unusual health event which occurs in that particular area. Then weekly submission of the report in relation to the integrated disease surveillance project, that is the report of the survey to the PHCs. So weekly submission of the report of the survey to the PHC where the subcenter belongs. That is about the services rendered by the subcenter under integrated disease surveillance project IDSP. So these are the first classification of the services rendered through the subcenter. So far we have discussed about the first part of the mnemonic, that is essential and desirable services through the subcenter, that is maternal and child health, coordination and monitoring, safe abortion services, that is MTP, outreach or field services, simple laboratory services, universal immunization, basic health care, control of local endemic diseases, national health program implementation, treatment for minor ailments and first aid, that is comes under curative services. Then referral services, eligible couple services, that is comes under family planning and contraception, school health services, record of vital events and integrated disease surveillance project. So these are the important essential and desirable services rendered through subcenter under Indian Public Health Standards 2012 revised version. Now the second part of the mnemonic is that is explain about the desirable services of the subcenter, which includes oral health, promotion of medicinal herbs, disability prevention, adolescent health care, care of elderly, that is national health program for the elderly people, and water and sanitation services. Let us discuss in short about the desirable services of the subcenter under Indian Public Health Standards 2012 revision. So the first desirable services of the subcenter, that is oral health. That is nothing but providing health education. So awareness on oral health and oral hygiene, especially to the antenatal mothers, lactating mothers, school children and adolescent children. So health education on oral health and hygiene. Second is providing first aid and referral services for the cases with any oral problems. So providing first aid and referral services for any cases with oral health problems. The second desirable services of the subcenter is promotion of medicinal herbs. So promotion of medicinal herbs. So locally available medicinal herbs or medicinal plants that should be grown around the subcenter as per the guidelines of the Department of Ayush. So as per the guidelines of the Department of Ayush, certain locally available medicinal herbs or plants has to be grown around the subcenter. This is about the promotion of medicinal herbs. The third desirable services is disability prevention. So prevention of the disability. So health education on prevention of disability, that is IEC, or health communication on prevention of disability. Then identification of the disabled persons. So identification of the disabled persons during the annual house-to-house survey, and if necessary making referrals, appropriate referrals of the disabled persons. So health education, identification and making appropriate referrals are the services comes under disability prevention through subcenter. The fourth desirable services is adolescent health care. So it is a desirable services that is providing education, that is health education, counseling and referrals of the adolescent if it is necessary. Then prevention and treatment of anemia among the adolescents. That is prevention and treatment of anemia among adolescents. The last one is rendering counseling services. So counseling on harmful effect of the tobacco and its cessation or stoppage of using. Then fifth desirable function for the elderly, that is National Program for Health Care of Elderly. National Program for Health Care of Elderly. So that includes counseling of the elderly people or elderly persons and their family members on healthy aging, promoting the healthy aging of the elderly people or geriatric people. So counseling of the elderly people or geriatric people with their family members regarding healthy aging. So taking care of the elderly people, counseling to take care of the elderly people. Then making referrals of the sick elderly person or sick old person to the PHC if necessary. So counseling and referrals of the elderly persons comes under National Program for Health Care of Elderly through subcenter as a desirable service. The last one is safe water and sanitation. This is the another desirable service of the subcenter, that is water and sanitation, basic sanitation to the area where the subcenter belongs. That includes disinfection of the drinking water source or disinfection of the well or chlorination of the well. Then promotion of sanitation, that is basic sanitation in the environment of the community or where the subcenter belongs. So these are the 6 important desirable services of subcenter under Indian Public Health Standards, that is 2012 revised. So thanks for watching. Don't forget to subscribe my channel. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the new community related or education related video. Thank you.